results came while researchers were studying 25,000 people who were taking a daily low dose of aspirin to prevent heart disease. But the researchers found that aspirin was also doing something else. It was reducing the death rate for some cancers. The work, a meta-analysis or study of many other studies, was done at Oxford University in Britain by Dr. Peter Rothwell.
What we found was in the trials where people had taken aspirin for 5, 6, 7 years on average, the risk of dying of cancer was reduced by about 25%.
In other words, for every 1,000 people who took a low dose of aspirin daily for at least 4 years, 23 people died from cancer. Compare that to 30 out of every 1,000 people who died from cancer in the group not taking a daily aspirin. The drug was especially effective in preventing deaths from colorectal cancer, lung cancer, and cancer of the esophagus. While aspirin has proven benefits, doctors warn that aspirin can also cause serious side effects.
As a rule of thumb, I wouldn't advise anybody, anywhere, to take aspirin by themselves.
Dr. Elmer Huerta is a past president of the American Cancer Society. He is a cancer specialist at the Washington Hospital Center.
There are certain groups of people who are extremely sensitive to the side effects of aspirin. They bleed, they develop gastritis and ulcers. So if people are going to go to the store and get aspirin and have it thinking that they are going to prevent cancer, they may end up in the emergency room with severe gastrointestinal bleeding.
Dr. Huerta says there are many other reasons people should not take aspirin. It could react negatively with other medications a patient is taking. And he says patients who already have cancer should not take aspirin without first consulting their doctors. And while there are studies that show that aspirin might decrease the incidence of polyps in the colon and the cancers that might result from them, this study does not show that aspirin actually prevents cancer.
The study has been designed to study mortality, not incidence.
Dr. Huerta says more large studies need to be done to find out how aspirin interacts with cancer cells. These studies would need to be randomized, assigning people by chance to the experimental group or to the control group, and would have to follow the people participating for at least 10 years. Carol Pearson, VOA News.